Okay. Hi again. Hi again.
Hi, Troops.
Hi, Dr. Dave, and to all participants. Okay, straight to the point. I call Dr. Dave. Over to you, Dr. Dave from Hong Kong, who will chair Breakout 2. Dr. Dave, please. Thank you.
Okay, thank you, and welcome whoever is here. I've got a bunch of faces and a bunch of names. We'll find out as we go along who's here. My name is Dave Osborne. I'm from Hong Kong. I'm usually on the other side of the fence presenting, so it's very nice to be refereeing situations today, to be an observer. Quick point, I really want to encourage everybody on the floor to ask questions and challenge the researchers and ask any questions that you're not clear on. That's just going to make for a more lively session. So enough said, let's get straight on. It's 2:00, just after. So the first paper is COVID-19 pandemic youth compliance behaviors towards movement control order, MCO. Can I kick that one off? When you're ready, are you ready?
Yes, I'm ready.
Okay, off you go. Good luck.
Thank you, Dr. Dave. All right. View time.
F5.
Cannot see. Okay. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thanks, Dr. Dave, because giving me the opportunity to present our article. Research member, my team leader, first Dr. Izzah Nur Aida, and then my Zuriani binti Ibrahim from College University Polytechnic Maro Kuala Lumpur, and then Professor Dr. Wan Kamal Mujani from University Kebangsaan Malaysia, Najmi Hayati from Indonesia. Okay, today I will to present our article entitled COVID-19 pandemics and use compliant behavior toward movement control order MCO. Sorry. Before that, I will discuss the abstract first. Research background. The COVID-19 outbreak has recorded an escalation in the number of severe cases in Malaysia and several other countries. Various mechanisms has been utilized to prevent infections and overcome the spread of the pandemic COVID-19. Such as standard operating procedure SOP that must be followed by all citizens, especially the youth. Objective, this analysis aim to investigate youth compliant behavior toward the standard operating procedure throughout the Malaysian government movement control order, which was implemented to contain and mitigate the cases of the COVID-19. Methodology, the design of this study is a survey study using a questionnaire instrument on 545 respondents selected among youth age 50 to 30 years in Malaysia. Meanwhile, the data was analyzed using descriptive statistical technique using IBM SPSS. Finding the result of the study revealed that the majority of youths reached positively toward MCO. The finding of this study can provide information to the youth, particularly regarding the COVID-19 prevention procedure and the need of following it. Introductions. According World Health Organization WHO 2020 defines COVID-19 as coronavirus COV to be a dangerous virus that causes respiratory tract. According Muhammad Hidayat and Muhammad Adnan 2020, coronavirus disease is an infections disease known as a severe acute respiratory syndrome coronavirus SARS and Middle Eastern respiratory syndrome MERS-CoV. This virus was identified in Wuhan, China, and this pandemic has continuously spread throughout the world following the significant increase in COVID-19 cases nationwide. The MCO 3.0 in Malaysia enforced total restrictions movement beginning June 2021. Selected sector of the economy are allowed to operate from 8 p.m. To 8 a.m. to 8 p.m. While other no essential sector are closed for 40 days. These restrictions, MCO is one of the measures recommended to be executed in a country to cope with a pandemic. The other is evident as the number of cases is increasing every day. Without a proper understanding, understanding and control, the virus could contribute the risk of more death in the country. And then problem statement. There are still some cases report Malaysia where public individual, dignitaries, politicians, celebrities, civil servants, and companies do not comply with the SOP set by the authorized. Meanwhile, the use or no exception is not following the SOP. Kelantan State Police Chief Datuk Shafi'i Mamat from his record state, he found that teen or young adolescents represent the highest number of age group that violate the SOP set to control and contain the spread of the COVID-19 virus. They play a big part in the helping the authorized to control, contain or break the COVID-19 chain. We can see statistic from the Department of Statistics Malaysia show that the population age between 15 to 30 years in estimate at 9.2 million. The numbers of represent 27.8% of the total population of 32.6 million Malaysia. To understand the situation better, a study was conducted to investigate the use compliant behavior toward the standard operating SOP during the movement control MCO. And then we can see literature review. Name COVID-19 on 11 February 2020 from Wuhan, and then virus spread worldwide, including Malaysia. And then the first 3 Chinese citizens enter Malaysia via Johor Bahru. On the 50th of March, Malaysia began the implementation of the movement control order. On the 25th of March, the Prime Minister, through a live national broadcast, announced a first extension of the MCO to last until for the 40th of April. And then no. Sorry. Ada previous. And this literature review. According Ferguson's
Can you speed up a little? We've got 3 minutes left. Could you just summarize?
okay.
Thank you.
However, a study on the relationship between the level of compliance with SOP of Malaysian, especially among youth, not widely discussed. Thus, this study attempt to investigate the behavior of youth compliant in Malaysia toward the SOP through the MCO to curb the spread of COVID-19 through the implementation of SOP during the MCO. This methodology, this study is quantitative study using a survey study designed through a questionnaire distributed to respondents. Second, the sample of the respondent in this study consists of 545 respondents. And then third, only one part involving 11 questions covering social aspect to evaluate the validity of the content of the item of this questionnaire, the validity of the item evaluated by Dr. Noshariani Abdul Rahman from a lecturer at the Islamic Hadari Institute, UKM. Thus, this pilot study conducted a total 70 respondents from KUPTM, Kuala University Politeknik Mara, Kuala Lumpur, and then University Technology Mara, consisting of 20 male plus 50 female students. The reliability of the Muslim youth adherent questionnaire instrument to the movement control order through the value of alpha reliability 0.820, good level of interpretation and is acceptable. The data using descriptive statistical technique using IBM SPSS, the descriptive analysis use percentage frequency distributions and the means value are more suitable to be used so that researchers get more comprehensive and comprehensive information, detailed and accurate as required in the objective of the study. This is finding. The result of the questionnaire found that the highest mean, I always scan my Sejahtera QR code before entering a premise, 3.89. Second, I always scan my body temperature before entering a premise. Third, I avoid being in crowded and cramped area during MCO. Then compare to the lowest item, which show mean moderate 3.28. I do not allow guests to visit the house during the movement control order, while item 6, 10, 8, 1, and 7 also obtain high mean score to preserve life.
Can you start to wrap it up now, please?
Yes. Discussions first, the result of the study found that the majority of respondents among youth comply with SOP through movement control MCO by constantly scanning the QR code MySejahtera before entering a premise. The finding is as explained by the Ministry of Housing and Local Government that Malaysia need to register by scanning the QR code, the MySejahtera. And then the analysis study also sitting at home if there was not need to go out, mean 3.79. This finding by Zuriani claimed that movement control order must be complied with by all Malaysia to confine themselves in residence and not to conduct large-scale gathering involving many people in venues, whether to worship or otherwise, as the movement control order gazette is from the Ulu Amri government to the people, where is in line with the government jurisdictions with need to guarantee the welfare of people. And then conclusion, whereas efforts were made by the authorized to ensure that the spread of the COVID-19 pandemic is contained and curbed, especially with the implementation of SOP during the MCO periods. This study is carried out to investigate the compliance behavior, use the standard operating SOP through the MCO, and researchers found out that the compliant behavior patterns of use at a good and satisfactory level. Majority respondent always scanning MySejahtera QR code before entering a premise. Scan body temperature before entering premise, avoid being in crowded and narrow area. Always obey the National Security Council instruction to avoid crossing district of state, sit at home. The finding of this study can provide information to the youth, particularly regarding the COVID-19 prevention procedure and the need of following it. This is because youth is an asset to the country. Thank you. Finish already.
Okay, thank you, thank you. Sorry to push you there, we were running a bit over time, not to worry. Before I throw it to the floor, I have a couple of questions. One thing I found interesting, you said at the beginning that the Kelantan State Police Chief said that he found the teens or young adolescents represented the highest number of age groups who violated the SOP. Yet your research concludes that researchers found out that the compliance behavior patterns of youth are at a good and satisfactory level. Can you comment and compare the apparent difference between those two opinions?
My opinions.
The conclusion versus the statement by the Kelantan State Police Chief.
This is study attempt to investigate the behavior of youth compliant, age 50 to 30 years. Hello?
Yeah, I'm listening. I'm curious because the chief, according to your report, the chief of police said the youth are the worst.
My sound is not. My sound is a problem, doctor. Sorry.
Let me try again. Your report says that the police chief found that the youth were the worst offenders for violating the SOP. That's the opposite of what your conclusion says. So I wondered what your opinion was of that discrepancy.
The conclusions, the result of the study revealed that the majority of youth reach positively toward MCO. The finding of the study can provide information to the youth, particularly regarding the COVID-19.
Okay. Anybody in the floor care to comment? Any questions from the floor? Deadly silence reigned. Okay, let me ask you one more question then. You said at the beginning, you said that your objective was to investigate Muslim youth compliance.
Compliance behavior.
Yeah, I just want to ask you, I'm always a bit nervous about using just the term to investigate. It's very general. Can you be more specific? To investigate, to discover what? Did you hear my question?
My partner, Iza, can you answer? I'm not here. Sorry.
Did you hear the question? Anybody there? Hello?
Hello?
Hi, did you hear my question?
Sorry, doctor, I'm not here.
Okay. My question was...
There is a problem, doctor.
Yeah. Okay, why don't we, if your sound is a problem, let's thank you for the paper. That was very fine. Any questions from the floor before we move on? Okay, thank you very much for that presentation. Let's move on to the second paper then. Thank you.
Hello, doctor.
Yeah. Okay, that's fine. Thank you. We're going to move on to the second paper now. Thank you for your presentation. Okay, how do we get back to normal on the screen?
Okay, thank you, doctor. I'm not here. Sorry.
Okay, thank you. We'll move on to the next one.
Okay, thank you.
Who's driving my Zoom? Anybody? Not me. What is going on? This is the second presentation. Who am I dealing with? Sorry, I seem to have lost control of the Zoom. So who's online right now? Is there anybody who's driving the Zoom? Okay. This isn't working very well. Come on, troops. Who's about? Can anybody hear me?
Yeah, Dr. Dave.
Yes, we can hear you.
Okay.
We can hear you.
Jolly good. So, there's a face. I've got a face now. I've got a bunch of things down the side. So we were moving on to the second paper. Is this, and I see it on the screen, is the presenter for the second paper about? Who's presenting it? Is anybody presenting it? Faces are appearing. Goody, goody.
Dr. Dave, Dr. Siti Noraini is on screen now.
Good. Okay, then let me just check out here. So, Dr. Siti, you are presenting, are you? Talk to me.
Okay, can you hear me now?
Okay.
Yeah. All right, good. Lucky. All right, hi everybody. Can I start now?
Hi, Dr. Siti. Sorry, we lost your volume a while there. Welcome aboard. The floor's all yours. Go for it.
Yeah, thank you very much. I hope you can see me as well in the video clearly. Hi everybody and good afternoon. My name is Siti Noraini Muhammad Tobi. I am presenting with my co-author Dr. Ernie Suzila and Dr. Nur Fazlina. We are from the Faculty of Business and Management, UITM. And together, another co-author is Dr. Henricus from the Indonesian University. He's also here today to join the presentation. And I would like to present on my research topic titled Role of Diffusion and Socio-Cognitive Towards Intention to Use the HEAD Portal Among the Consumers in Malaysia. Okay. So for the introductions, so this study marks its inquiry regarding the national head portals called My Head Portal. It is actually belongs to Ministry of Health in Malaysia. It has been registered and developed in 2005, but the outcome is known to be limited. As you can see in the slide, it is the My Head Portal official website with the address, and it served the Malaysians basic information regarding healthcare and so on, some tests and activities to assess your healthcare level and so on. It is open to public free of charge. And actually, this million spend portal has been developed in 2005. Actually, the government wants to boost the usage among Malaysian citizens. However, the usage is known to be very limited. Just this study is help to understanding what are the factors, uh, specifically what are the key factors that contribute to the intention to use of these portals among the Malaysians. And why this research is important actually. The usage of this portal is still very important as the Ministry of Health aimed that it could replace the doctors in terms of providing accurate and reliable information for the Malaysian citizen. Due to the NCD cases has surpassed the communicable disease in Malaysia in terms of morbidity and also mortality. NCD is like the cardiovascular diseases and hypertension. And in fact, non-communicable diseases is the major causes of admission in public hospitals. And also the usage and the reliance on these portals is seen to be important as Malaysia will be facing a country of aging in 2030, where more than 15% in our citizen will be those aged 60 years and above. Therefore, we will issue due to the medical, some financial burden to treat these older people in terms of their diseases. And these are the research model. We want to look at the what critical success factor that influence the citizen usage of this portal. And basically, we will look at the diffusional aspect that will influence the attitude toward using these portals. And we will be also looking at the social cognitive aspect to use the portals. And hereby, we look at the research model where the diffusional aspect is representing by the Rogers Innovations model. We look at the three construct here. There are complexity, triability of using my portal, and also the relative advantage of the portal towards the attitude. And meanwhile, we will also look at the theory of reason action, representing the social cognitive aspect, to look at how it influences towards intention to use of the portal among the Malaysian citizens. These are the basic underpinning theories that being used within the study. And this is the research methodology where actually we sample the people that is included within the study through the portal itself at the www.myheadportal.gov.my, and we managed to included around 200 and plus numbers of respondents to join the study. And based on here, it is only minimum sample size required for 110 to be tested for sample PLS. Thus, I would consider the numbers is quite maximum. And these are the construct based on from adopted and adapted questionnaire. Data analysis part, I'll jump this one. And we had conducted the measurement models and also the structural models to come up with the parts coefficient significance analysis. And the measurement models, the reliability scored between 0.89 to 0.96, which is quite high throughout all the 6 contracts. And indicator reliability for auto-loading, where deleted 8 items overall that scored below 0.7. All IVE values scored more than 0.5. And so all the assumptions in discriminability were met. And for the R-square values, the attitude shown 67.6 numbers of variance, and for the intention is 58.9. And it could be considered moderate according to Hare 2011. And these are the PET analysis significance. And what I can conclude, out of 5 PET analysis here, offered only 3 were deemed significant. There are triability towards attitude, and was a relative advantage towards attitude, and so attitudes of the help consumers of my portals to the intention to use the portal in the future. And back to the conclusions and summary, the findings within the study does support the diffusional factor with mainly with regard to triability and relative advantage. on the head consumers' attitude towards head portal usage. Well, throughout this study also, we have found that key important factor, the main really important factor that influence the people in Malaysia to use head portal is due to the relative advantage construct, whereby here relative advantage is seen as something that is offering more benefit and advantages over the other traditional and alternative mediums, such as magazines and typical blogs and whatsoever. And also within the study, there's no adequate support for diffusion of innovation through the complexity construct can be found. And for the second conclusion, through the CRA models, we have seen that users' intention is determined clearly by their attitude towards the head portal. And what can be the reasoning behind these findings is due to the level of complexity that have been found in the study that is quite low, meaning to say that those people who are trying this portal, my portals by KKM, found that it is such a friendly use portal. There's no some complexity in the use of portal. Thus, it leads to the positive attitude of the portal and also lead to the what we call that user's intentions of the portal through the constructive attitude. Meanwhile, through the another construct that is subjective norms towards the intention to use, there's no such evidence found within the study. Thus, you can see that the hypothesis was rejected. And what is the importance of the finding? Where I could guess that since we had identified the relative advantage, it's become the key factors within this study. So it is indicating that the Malaysian citizens like Mahat Portal. Why? Because it is quick, it is easy method, and it is a likable alternative, and at the same time it is cheaper and even free of cost. Right? So why not? It is being used by Malaysian citizens, and furthermore, with Malaysians' current psychological health level in Malaysia are decreasing, where we can see the suicide cases are happening every day. And in fact, Malaysians are experiencing a very high depression levels and also anxiety levels. So what ministry could use these findings regarding its advantage? Why not the ministry putting something to trade on the psychological aspect and offering that using these portals instead of just ordering those who are affected with psychological level just to go to the hospitals and waiting for a quite severe long due appointment to seek for their psychologist. So maybe the Ministry of Health could just, kind of helping these people who are suffering, just providing it online at these portals officially, like consultation online and so on, so that they can benefit from the research findings. And second one, since tribalism was shown as having a significant relationship, it shows that those citizens who have tried this portal, they would use it more in the future with the guarantee that they already use it for once. Then they will come into the future and use this portal again. So maybe why most of people, our people in Malaysia, the citizens, is not using it because they do not know the existence of the portal. And the study also have found and proved that once they use it, they know about it, they want to use it again. Let's the KKM, Ministry of Health, make it more advertisement regarding these portals online, maybe in FB, social medias, and so on. Let the people know more about this one and let them use and benefit of it since millions have been spent on developing the portal just for the sake of Malaysian usage. So I guess that's the all presentation. That's my presentation. Thank you very much. Back to you.
Thank you, Dr. Siti. That was very nice. Well-structured piece of research. Can I ask you before we throw this open to the floor, in your conclusion page, item number 3, on your conclusion? Yeah, I didn't understand that. Would you mind just explaining point number 3 a little bit broader for me, please?
All right. So this is actually the what we call the outcome or the goals of this research study is to have the Ministry of Health in the future, once they know the finding within this study, help them to boost how they would like to arrange the portals more beneficial for the citizens in the future. I mean, when they know the relative advantages is the key factor. I mean, using the information, imply it to the portal and make use of it to the maximum so it can be benefited more by the citizens.
I thought that was one of the objectives to begin with.
That's also part of the adjective, and here and enhance it again as a conclusion here.
Okay, cool. Sorry, I just wanted a little clarification for myself. Can I ask one more question before we throw it to the floor? I was fortunate to be able to go through your paper. And one of the things you stated in the paper, you said, overall, this study suggested that the portal's complexity level does not contribute to the health consumer's attitude. Complexity level does not contribute to the health consumer's attitude. I found that quite interesting. I found it surprising. And you also mentioned that this was not consistent with previous studies. You referenced one 2012 on it. I just wondered if you could comment on that. Should I be surprised? I was surprised. Common sense tells me that if it's complex, I'm going to have a bit of a negative attitude, but you're suggesting that's not the case here.
Yeah. May I answer it?
Yes, please.
It is probably due to the low complexity level rated by the respondents. It shows that they seem the portal is very easy to use, very friendly. However, it should be have positive attitude.
Akachi said 15 minutes.
Yeah.
Some guy
So
from
yeah. Hello?
white guy, I don't know from where.
So okay.
David Osborne.
Okay. So yeah, it should be expecting any some kind of relationship somehow. The smart PLS doesn't capture it that way. However, we want to assume it as having positive relationship between complexity and attitude, but it doesn't seem that way.
Right.
So the complexity level is low, so it's quite surprising as well.
Okay, cool. Thank you. Let me throw it over to the floor. Do we have questions from anybody on the floor? Everybody disappears on me again.
We are hearing, but we don't have any question to ask her.
Yeah, so far so good.
So far so good.
Okay, let me ask one more then, if I may sort of have a quick look here. There was one other. Yeah, it was regarding the constructs that you took from two theories. You took two from diffusion of innovation, and you took three from the technology acceptance model. I'm not familiar with those, so I might be asking a really dumb question, but I'm good at asking dumb questions. Were they the only constructs, and why did you choose those constructs? Was there other constructs that you ignored, or were these the only constructs within those theories?
So the reason why I did use and rely on these both theories, since it had been used within the similar study in overseas. So since this is the first in Malaysia, however, I need to be based on something that is really established, and I guess these two models just be the best underpinning theories that so far that I can deliver. And hopefully for the future, I could be based on other theories like psychological, which is more interesting to look at, and so on. But for the first basis, I think this one is the right one for the time being.
Right. Okay, cool.
I've used many in other empirical studies.
Yeah. One very small point. When I was looking through the paper, couldn't help but notice that only one of your references was within the last 5 years, which was Hare et al. 2012. Sorry, 2017. Again, not a big issue. I just wondered, because this is specifically related to internet issues change very quickly or develop very quickly. Is there any concern that you may have missed any significant studies of a more later date?
So I admit that due to the references, it's not too up to date. You know, and it's not 2009 and above. So hopefully that for the reviewers' comment, I am expecting that they would commenting on that. Please add more reasons to support your studies. I guess that's what I should do. And I'm just presenting what I have, but it can be improvised and it can be enhanced furthermore to be a better level.
Right. It's a small point, but simply because it's internet related, I feel that We just have to be a bit aware of, the most current research.
Yeah, I agree
Um,
with that.
That's cool. That's great. Anybody on the floor want to join the conversation? Come on, girls and boys. No, okay. We'll start. Thank you so much, Dr. City. We'll call this. We'll move on to the next paper. Thank you so much.
Thank you, Dr. David.
Okay, so paper number 3. Issues of applying occupational-based intervention among Malaysian occupational therapists, mixed method study. Do we have the author?
Yes. Can you hear me?
Hi, I can hear you clearly. Thank you. Are you ready? Have you got your presentation? Are you ready? Good stuff. Okay, when you're ready, you have the floor.
So I'll start my presentation now.
Yes, please.
Good afternoon to Dr. David and my faculty members. My name is Aisha Ahmad, and other two members of this study are Dr. Ahmad Jamal Shidawat, Associate Professor from Total University of Technology, and then Abdurrahman Azlan. Presentation today entitled.
I'm sorry, can I interrupt? Sorry, can I interrupt? Your sound is not very clear. Can you get closer to the microphone?
Can you hear? Better?
That's better. Let's try that.
Today's presentation entitled The Issues of Applying Occupation-Based Intervention, OBI, among Malaysian Occupational Therapists, the mixed method study. These are the presentation highlights for today. I'll introduce to you the term occupation. Occupation is the activity and task of everyday life, named, organized, and given value and valuation and culture. So occupation is the core concept of occupational therapy, and it is regarded as the identity of occupational therapy. However, to our history, since it has been class factor, then occupational therapist using its professional identity. So occupation-based intervention is an integrated factor to some in occupational therapy practice. The bundle of challenges in implementing OBI. This is not about the perceived barriers to different areas of occupational therapy practice in Malaysia. So this is a brief overview of occupational therapy in Malaysia. Malaysia is a developing country where the culture emphasizes on collectivism, based under the governance of medical rehabilitation and merged with physiotherapy slash professional activity. The number of OT compared to American population is low, and it meets a minimum requirement of trauma level to become an occupational therapy in Malaysia, which is considered low. And there are only few institutions that offer this course in Malaysia. And next, sorry. So this is OBI. OBI has been defined ambiguously in the literature. However, from previous study that it out in 2016, a consensus definition of OBI has been developed from the Malaysian perspective, where it means it is defined as occupation of means and occupation of NN. Continuous using the scientific occupation as the therapist is an agent to immediate impairment, while occupation of NN is the participation of clients in meaningful occupation and then within the client context. So this is the purpose of the study to discover and explore perceived barriers to implementing OBI in diverse areas of occupational quantitative, which is using study, and study which is using by using a focus group discussion. So this is the literature review. Before I start to explain the literature review, it is worth knowing that occupation most of the studies pertaining to challenges in implementing OBI have been conducted from developed Western countries. And occupational therapy profession itself has been originally founded in the Western country, and therefore the values, the foundational element of the OT is more associated with culture, Western values. So as you can see here, Western is more individualist, while Eastern is collectivist. So the process of providing OBI includes the client's active participation and involvement in family decision making. So in order for them to recognize entirety and meaningful occupation, is established in that that should inhibit the sense of autonomy, mastery, and competency of themselves, where these values are most evident in individualist culture. Next is the differences between Malaysian and Western countries. Is Malaysia is a developing country, while Western countries are mostly developed. And a study has stated that the barriers to implementing OBI vary according to culture, family beliefs, mindset, focus settings, context, and policy. And a previous study of identifying the specific barriers in implementing OBI has been conducted in Malaysian context. However, it was conducted in the context of hand rehabilitation, and the participants were among hand therapist experts who were practicing in the public sector. While as we know, OT served a wide range of clients from newborn to the elderly who are either physically or cognitively impaired. So therefore, the result may be inconclusive with diverse areas of OT practice while considering the different types of client and setting. Therefore, to explore relevant perspectives regarding the issues from idiosyncratic nature to this context, the study was needed so more pragmatic solutions can be done to enhance ODI implementation. So this is the methodology. I use a sequential explanatory method design for this study where I conducted where they have two distinct phases, started by a cross-sectional online survey and proceed by focus group discussion. The finding from the focus group discussion will be used to complement and explain the result of the cross-sectional online survey. So this is the study design of both studies and the data collection. Next, so this is the inclusion criteria of the cross-section study and the focus group discussion. So now I will explain about the quantitative data analysis. Okay, in the cross-sectional survey, we use a questionnaire, and in the questionnaire that the participant needs to rate analyze the totally disagree to totally agree on a statement given. The statement was classified under 5 categories of barriers, which are time factor, voting factor, contextual factor, occupation achievement modality, and logistic issues. And the survey statements will consider barriers if the proportion in which participants agree to totally agree with the statement were higher than 50%. So this is the descriptive analysis of the study by gender, by area, and by experience. And so, as I mentioned just now, there were in the questionnaire there were 5 categories of barrier. However, the results shown that only 4 categories of barriers perceived as barriers from Malaysian context. And I have just stated the statement that achieved more than 50% for totally agree to totally agree under each category. So first, the timing factor, contextual factor, occupation, activity, modality, and logistic issues. Next is qualitative data analysis. So
Kena tengok lah dia punya condition of the site tu. Tapi kalau dia tak bagi condition, you can propose both tu lah. Tapi bagi tahulah reject tu untuk masa bila, flexible tu masa bila.
So this study was analyzed by incorporating 2 frameworks of analyzing focus group study, which are content analysis and microinterlocutor analysis that use to analyze the interaction data. So in the analysis, it comprises of 2 phases, which are either using MCA, which is known as content analysis, or latent content analysis. So this is the brief process of the content analysis. First, we start with transcription and we organize the transcript according to content areas. Then the data will then analyze using either latent content analysis or latent content analysis. Then the result from the finding from the latent content analysis and latent content analysis were integrated, and this is the finding of the final finding of the FDP. So the finding we presented it as the issues of as group and subgroup. So the group is the issues of implementing OBI, while the subgroup consists of 6 subgroups from the governance and policy to the financial challenges. So this is the discussion part. So so it's actually the data analysis, integration, and presentation lead to coherence of the quantity result and the qualitative finding with respect to the outcome. Is that the MCP finding might be able to confirm or expand or distort the results of the cross-sectional study. So the first result is under the logistic issues, which are OBI is time consuming and income function and heavy workload. So it can this so from the MGD, the governance and policy of the healthcare system, which include organizational policy and organizational system, has been the participants have mentioned this as to explain to further explain the results from the cross-sectional study, where they stated that mostly public sector practitioners encountered this limitation because they're subjected to organizational policy and workplace. And they also agree that OBI is time consuming and complex, and it is hard to be practiced in the respective system. And also, this study has supported this by stating that aligned with the postulated that work motivation among nursing and professional scientists in the public sector was lesser than its private counterpart due to the bureaucratic system which focused on complicated procedures. Next is under the cross-sector study, logistic issue, it has been stated that the lack of specific guideline from MOSA has become the barrier in implementing OBI. And from the MCD, the participant has explained further that it is not only the guideline, but it includes the references and training that are available that limit the implementation of OBI. So OBI is an evidence-based practice and it's vital to have a reference for practice to ensure its coherence with the conceptual foundation. Next, under the barriers, under the category of the contextual factor, which is dominance of biomedical model. So, and under, okay, in this slide, it has shown this part between the FG finding and the cross-sectional result, where from the cross-sectional result, there is a statement mentioned about the bureaucratic system. However, it has not been specified barriers. It's not 50% of agreement. But then in the FGD, the participant has mentioned that the bureaucratic system is one of the issues that limit the implementation of OBI. And another thing is about the barrier under the category of occupational therapy factor, where in the cross-sectional study, none of the segment under occupational therapy factor were regarded as a barrier. However, in the MGD, most of the participants have agreed that occupational therapy factor is one of the issues in implementing occupational-related intervention. Okay, and next is about the contextual factor, which is cultural values of specific roles. This is discovered under the cross-sectional study, while in the purpose of discussion, the participant has further explained about the specific challenge, the specific issue related to cultural values and research. They mentioned that the culture which not value independent, especially among individuals, and their inability to decide on own meaningful occupation has made the ideal practice of OBI challenging to be practiced. And also, the study from Context of Asian countries, which are Singapore and Thailand, has stated that the Otis Philosophical Foundation is difficult to translate into the Asian format to this culture. And then, okay, this is under contextual factor that actual awareness by other professionals limits reference for OBI. So in the FGD, the participants explain why we have lack of role awareness because of the fragmented implementation of the multidisciplinary team is not working in an integrated manner because the partner is separated from each other. Okay, so this is one of the this barriers has been identified from the participants. However, none of the statements under the questionnaire mentioned challenge. The questionnaire actually was developed from the time our study is of the mentioned just now among the therapists of public sector. This is because the limitation of that study was the participants would come from the public sector. The public sector, the service has been subsidized by government. That's why none of the participants mentioned about the economic challenge. However, in my discussion where we included both practitioners from independent from private sector and public sector as well as independent practitioners. So they have identified that economic challenge is one of the barriers in implementing this intervention. So the limitation of study is of the uncertainty of the service participant, whether any of them is included as the active participant due to the anonymity of service participant, and the conclusion is despite the mandate to the rate of participation will concentrate ongoing challenges to centralize application of participants with consented by AcE. So the study highlight multifaceted barriers faced by occupational therapists in implementing OBI, which requires solutions beyond the individual level. So we would like to discover more solution which more appropriately simulation context. These are the references. So we acknowledge our Thelma Cutworth Foundation Award for Research Education for funding this study, and this has the contact information of the authors. So that's all from me.
That's great. Thank you. Thank you very much. Let me begin the question. I have. Can you hear me? Okay.
Yes.
Okay. One thing particularly interested me, because obviously I'm a Westerner. You mentioned the difference between Western individualism and Asian collectivism. Yet in the findings, you focused particularly on logistics. You said the most perceived barrier was logistics, logistics issues. And there's virtually no reference in the findings to those cultural issues. So my question is whether or not the Western Asian collectivism, individualism, did that feature in your findings or not?
Can you repeat once again?
Okay. You made a point at the beginning of your presentation and of your paper to point out there is a difference that Westerners have an individual approach and Asians have a collective approach. And yet, and it seemed at the beginning of the paper that that was going to be a major issue. But in the findings, there was no reference to that cultural difference. It was only logistic differences. So, as I say, did you find anything significant to a collective environment versus an individual environment?
Just now I have shown the discussion about the contextual factor with about the cultural values of Malaysians. When Malaysian cultural values tend to adopt key role, and from the finding of the MPD, it has become one of the challenges to the where the participants stated that it is hard for the occupational therapists to discover the meaningful occupation of occupational therapy, the meaningful occupation of the patient, because the main the essential element of OBI is to find out the meaningful occupation of the person inflicted by injury. Because normally when people are inflicted with injuries, they tend to depend on others, so they won't be independent. So that's why it's hard for Malaysian culture to value occupation in their life when they are inflicted with injuries. Is it answering your question?
That's cool. Yeah, I'm sorry. Your sound is not very clear, and that's just maybe my computer. But that was fine. Thank you. Any questions from the floor? I don't want to hog all the conversation here. Do I have any questions from my audience? Do I have an audience? Okay, let me wrap it up. Let me ask one more question, then I'll wrap it up. You also mentioned that qualities, I'm reading from your paper, qualities of autonomy, mastery, and competency are more relevant to individualist culture and might not translate to the Malaysian culture. it was unclear from your conclusion what your findings were in regard to that statement.
Normally, the barriers identified from the Western developed countries, it has not included the cultural issue. The cultural issue has not been perceived as barrier. However, the study from Malaysian context as well as other study from Asian context has included cultural issue as one of the limitations in implementing OBI.
Okay, cool. That's fine. Thank you. Any other questions from the floor? No? Okay, thank you for the presentation. That was very complete. Thank you. Right, let's move on then to paper number 4. Ocular complications. Ocular complications in contact lens wear and the risk factors, a retrospective analysis. Do we have the authors? Yes, we do. Oh, we have a presentation. Hi.
Hi.
Hi,
Can you hear my voice?
I can. Lucky me, huh? If you're ready, take it away. It's all yours.
Okay, good afternoon. My name is Liliana from Center of Optometry Studies from Faculty of Health Sciences, UITM. I'm going to present our research on entitled Ocular Complications in Contact Lens Wear and the Risk Factors, a retrospective analysis. So my co-authors are not here today, so I will try my best to answer any question. Okay. Before I start, I would like to explain a little bit on the keywords for my paper. Contact lenses are basically medical devices commonly used to correct refractive errors, and there are special contact lenses used for therapeutic purposes. More recently, contact lenses have improved its design and materials, therefore becoming more popular among students and young adults for cosmetic purpose. In Malaysia, 28% of its total population wear contact lenses, and this is based on data in 2014. Among the issues with contact lens wear that are risking lens wearers to contact lens related complications were non-compliance to lens care regime, poor hygiene, wearing contact lenses more than prescribed hours, and lack of routine eye examinations. And another factor is poor lens fitting that could also increase the ocular complications with contact lens wear. In cases when there are lens-related complications, the signs can be seen from several structures, several ocular surface structures that are the cornea, the tear film, the limbus. The limbus is actually the interjunction between the cornea and the white part of our eyes, which is the bulbar conjunctiva, and also it can occur on palpebral conjunctiva, which actually the inner linings of our eyelid. So the complications vary from mild to severe, and it can be non-inflammatory or inflammatory, but those complications are preventable. Prevention strategies should focus on the modifiable risk factors, which are the non-compliance and contact lens fitting. So this can be achieved via preliminary eye examination that eye care practitioners use to assess the contact lens fitting to determine an optimum lens fits for the patient, and also the aftercare visits whereby the eye care practitioners identify early signs of ocular complications and also monitor the lens wearer's hygiene behavior. So in this study, okay, based on the literature, we know that ocular complications could occur as a result of non-compliance or poor lens fitting, but the risk factors are modifiable, and it also varies across different populations. So Investigations of the lens-related ocular complications and the enabling factors within the young population is vital. So in this study, there were two objectives. The first is we want to determine the ocular surface complications among the university student population, and we want to identify the risk factors among soft contact lens wearers. This study is a retrospective analysis of the patient record file at University Technology Mara Optometry Teaching Clinic between March 2019 to March 2020. We extracted data on patients' contact lens fitting assessment and also the contact lens related complications. Only the data for patients who wear soft contact lenses for at least 6 months prior the data extraction were retrieved. Those wearing contact lenses for therapeutic reasons were excluded from the analysis, and information on the patient's habits were collected through a questionnaire. Okay, now coming to the results. Okay, a total of 33 record files extracted for this study. All contact lens wearers were university students, predominantly female, aged 19 to 26 years old. Majority were from Faculty of Business and Management, followed by Faculty of Health Sciences. For the characteristics of the contact lens wearers, overall, the majority of students use monthly disposable contact lenses for a minimum of 6 hours up to 12 hours. They have worn contact lenses for more than 2 years, so we categorize them as experienced wearers. Most of the contact lens wearers purchase their contact lens from optical shop, followed by internet. And the two factors that were considered by the lens wearers when they choose the lenses were comfort and price. In terms of the habits, a majority of the contact lens wearers wash their hands before handling the contact lenses. They also clean their contact lenses and change the solution in the lens case before the lens storage. The lens wearers, majority of the lens wearers have never swim with the contact lenses, and all of them have claimed that they have never cleaned their contact lenses using the tap water. However, about half of the contact lens wearers sleep with their lenses, and therefore this would be the most non-compliant habit among the study population. Okay, based on the chi-square analysis, there were no significant difference in all behaviors previously known to be the risk factors with the location of purchase. Even though it is not significant, we also can see that we observe that more lens wearers who did not purchase from optometry practice were non-compliant, particularly in 3 aspects, which most of them did not wash their hands before wearing contact lenses. They did not clean and change the solution before storage. Retrospective analysis of the anterior ocular health from the patient record file showed that the presence of 5 types of complications that include the conjunctival hyperemia, limbal injection, contact lens related papillary conjunctivitis, and corneal staining and corneal neovascularization. Grading of the complications revealed that most of the lens wearers had mild complications. None of them had a severe complication. Okay, so based on the analysis, the most prevalent complications were the conjunctival hyperemia, followed by CLPC, corneal staining, and the limbal injection. So from this analysis, retrospective analysis, we also found that contact lens wearers, sorry, trouble to change this. Sorry, I have trouble to change. Sorry, my slide stuck. Okay. Okay. Association test between ocular complications due to contact lens use and lens fitting revealed that there was a significant association between contact lens fitting with two types of complications, which were the limbal injection and CLPC. So it means that contact lens wearers who wore tight or loose lens fit are prone to get these two types of complications compared to those who wear lens with optimum fitting. Okay, now we move on to the discussion. Okay. Comfort followed by price were the main factors that we found the wearers considered when buying their contact lenses. Our findings were similar with previous study, and in previous study, lens discomfort was the main reason for contact lens dropout. Therefore, it is not surprising that this could be the utmost priority for the wearers. Second factor, which was the price, was considered by the lens wearers because probably they were all students. So financial circumstances could be the most important factor for them. However, in this study, we did not obtain the financial statements of the students. Therefore, we could not find find the relationship. The most common complication was conjunctival hyperemia. Earlier findings by Forrester cited CLPC and corneal neovascularization instead as the most common complications. The discrepancy probably because in their study they also combine soft contact lens wearers and also the other types of contact lenses like RGP or scleral lenses, and therefore their results were different from us. In this study, we only focus on the soft contact lens wearers, and previous study also supported that soft lens wearers prone to suffer from conjunctival hyperemia compared to other types of contact lenses, particularly rigid lens wearers, and also compared to non-lens wearers. In this study, sleeping with contact lenses reported by almost half of the lens wearers. So this was the most non-compliant habit, and it could increase the risk of ocular complications. But our findings did not show any significant association between sleeping with contact lenses and any 5 of the ocular complications. However, previous study found a causal relationship between microbial keratitis with sleeping with contact lenses. So a possible explanation why we did not achieve an association in this study is that even though half of the lens wearers reported sleeping with the lenses, but the frequency of those behavior was actually not frequent. They did not always perform the behavior. So that's why the complication was mild for the and for all types of complications. When we identify the association between lens fitting and ocular complications, it was significantly associated with limbal injection and CLPC, meaning that contact lens wearers who wore tight or loose lens fits were prone to get these two conditions compared to those who have optimum fit. These findings are in agreement with previous study that show that loose lens fit have a greater amount of limbal injection compared to wearing optimum fitting. And the association between fitting and CLPC was supported by previous investigation that shows lens design could actually trigger CLPC. However, in our study, we did not obtain the information on the lens design. For the conclusion, the present study suggests that ocular complications, minor to moderate, can occur with daily wear of soft contact lenses, and that almost half of the lens wearer at least had 4 common lens-induced complications. Although the complications were mild and considered non-sight threatening, but all 5 types of complications were asymptomatic. This accentuates that the importance of preliminary eye examination and also aftercare visits for eye care practitioner to conduct regular monitoring, because even though it's asymptomatic, so it can progress to something that is inflammatory. Contact lens wear is popular among youth, so we can expect that complications are more prevalent in this age group. So eye care practitioners can pay more attention to these modifiable risk factors during patient education to strengthen the prevention strategies. The limitations of our study is that this is a retrospective analysis that shows only mild to moderate cases of daily wear soft contact lenses. So the findings are not suitable to extrapolate to extended lens wearers or other types of lenses such as RGP. The results were less generalizable because the sample size was focusing on university students, not the whole age group of the young adult population. So future research should identify lens materials and incorporate practitioners' observation in assessing hygiene on larger samples with cultural diversity, cultural and age groups diversity. That's all for my presentation. Thank you.
Thank you. That was very good. Thank you. Right. Can I start with a quick question? I have a quick question because right at the beginning you mentioned, it's a small point, but you say that 28% of the population wears contact lenses as of 2014, but the supporting reference was 2011, which was kind of
there contradicting.
Yeah, so just look into that. But apart from the disparity in dates, one thing struck me was that even though the data is still 7 years old, so the question is, are you satisfied that the research, the data that you referred to is updated sufficiently? I'm just thinking in terms of whether there have been any changes or improvements in technology to produce contact lenses which might reduce some of these conditions. So is that an issue or not an issue from your point of view as a researcher?
In my point of view, there should be changes in terms of the data, in terms of the prevalence data, because in 2014, particularly in Malaysia, the use of other types of contact lenses like the orthokeratology is not so popular back then. The data that I provided, the prevalence is actually for all types of lenses, not in particular for the soft lens. So if we look back again, if we would like to take a look again on the prevalence data of contact lens wearers in 2021, I believe the prevalence have increased because of the more people have used orthokeratology lenses now compared to back then. So I expected that there could be some increment of the percentage.
Right. Okay, cool. Any questions from the floor again? Haven't had a question yet.
Okay. Okay, I have a question.
Thank you.
Liliana. Okay. My question is related like how does the risk of I wear contact lens, so I've been wearing it for more than 30 years. How does the risk increase as you age? Because I wear it more than 12 hours, like from 8 in the morning until I go to bed at midnight. So would the longer you wear it, the more risk there is, and then also the time. If you could enlighten me on that.
Okay, thank you for the question. Of course, the risk, I cannot say it's confirmed, but there is a tendency that you could actually get more complications compared to 30 years back then, because our ocular physiology changed with age. In particular, with the tear film, the tear film could have been reduced. So people who are aging, who have tendency to have dry eye. So when you wear contact lenses, they already affect the quality of your tear film. So with the effects of aging, it will further aggravate the dryness with the contact lenses, and therefore you probably have the higher risk to get dry eye. Not only that, once you have dry eye, it could also affect your cornea, so you can have higher tendency for the corneal staining. Yeah. Yes, my answer is that the risk could increase with age because of the changes in the ocular physiology itself.
Thanks for the question.
Sorry, another one, like sleeping there. Okay, I really like sleep at night with my lens on, but during the day, that maybe I sleep like maybe 1 hour with the lens on. So there's also increased the risk, right? Even sleeping during the day.
Correct. We did not find any association in our study, but I would like to cite a lot of international studies, or even in Malaysia, they found association between sleeping with microbial keratitis. And of course, the habit of sleeping, it first occur between 30 minutes to 1 hour, but then in some patients, the hours of they sleep with the contact lenses increase with time, because they found that there's no complications to their eyes or vision, so they think that it's okay to sleep more with the contact lenses. But it's you need to be careful when you wear contact lenses. Actually, sleeping with contact lenses is a big prohibition. The prohibition is actually clear, and any optometrist would say that you can't sleep with contact lenses. But of course, when you say that you just take a nap about 10 minutes, but sometimes it can actually goes beyond 10 minutes. It can go longer than that. So the effects of the everyday effects of sleeping with contact lenses can actually cause a mild complication. It will start with a mild complication first, and then it will aggravate to microbial keratitis. So that's the answer.
Okay, thank you for the questions. Any other questions from the floor? No, okay, troops, that's what thank you so much for your presentation. Great one. Right, moving on to our last paper then, which is solvent-induced hearing loss from occupational exposure in Asia, a systematic review. Do we have our presenters?
Yes, hi, Dr. Dave and everyone.
Hi.
Okay.
Are you ready to go?
Yes, Doctor.
Fantastic.
Are you able to see my slide, Doctor?
Pardon?
Are you able to see my slide? Can you see my slide?
Yes, I can. It's beautiful. Thank you. Okay, the floor's all yours. Take it away.
Okay, thank you, Dr. Dave. All right, Assalamualaikum and a very good afternoon, everyone, especially to Dr. Dave. So my name is Ainul Nakia binti Zainal Abidin. I would like to present my paper entitled Solvent-Induced Hearing Loss from Occupational Exposure in Asia, a Systematic Review. So I would like to introduce my research team. We have Professor Madya, Dr. Muhammad Shukri bin Muhammad Aris from Faculty of Health, University Technology Mara. And also we have Professor Madya, Dr. Aileen Razali from Faculty of Medicine, International Islamic University, Malaysia, IIUM, Kuantan, Pahang. And also Dr. Noor Azura from University Malaysia, Pahang. And also Dr. Adrian Fuente from Faculty of Medicine, University of Montreal, Canada. Okay, WHO has estimated 466 million people, which equivalent to 5.5% of people worldwide have disabling hearing loss. According to WHO, as you can see here, today, 1 in 5 people worldwide live with hearing loss. However, By 2050, 1 in 4 people are projected to have problems with their hearing loss. The hearing loss here could be from various factors. One of the factors stated by WHO is from ototoxic chemical exposure. In industrial setting, noise is could not be assumed as the only risk factor that will cause hearing loss, because the workers are also exposed to other chemicals which could be ototoxic chemical. However, majority of workers, especially in Malaysia, do not aware the hazardous effect of this ototoxic chemical. Okay, let's look at the aims of this paper. The aim of this study was to highlight and provide the up-to-date current state of the research on solvent-induced hearing loss in Asia. And the objective was to explore the available scientific literature on the adverse effect of solvent on workers' hearing in a diverse occupational setting in Asia. I believe most of you have questioned why we choose Asia, why we focus on Asia. I would like to draw your attention toward this graph. This is the graph projected number of people with disabling hearing loss in 2030 and also 2050. As you can see here, it is clearly shown that Asia region contribute the highest number of people with disabling hearing compared to other region. Next, we move to the methodology. This is my inclusion and exclusion criteria. The papers or the articles have been selected from year 2000 onwards. It is a peer review article and available in English. And we focus on occupational workers who exposed to solvent. And of course, we focus on Asia region only. Right, this is my selection process. So for the identification of the studies, we use PubMed and also Web of Science. Initially, we have 125 papers. After considering the inclusion and also exclusion criteria, and also we do the snowballing, forward and backward snowballing, the finalized article was 15 finalized articles selected for this review. Okay, next, let's look at the key finding. So for the key finding, we focus on the interaction effects between solvent and noise towards hearing. As you can see here, the pie chart here, 67% of the study shows there was a synergistic effect between solvent and noise towards hearing. So it means that there was a greater amplitude than the predicted sum of individual solvent and noise exposure. All right, and then we have 13% of the study claim there is an additive effect between solvent and noise, and 20% shows that there is no interaction effect between solvent and noise towards hearing. From this 20%, one study do not measure hearing loss from the combination of noise and solvent. So it just measure the hearing loss from individual exposure, solvent only group and also noise only group. So we cannot establish the interaction effect between solvent and noise. Okay, other than interaction effect, we also focus on the affected frequency of hearing loss. So as you can see here from this pie chart, 80% of the studies shows that the hearing loss was affected at high frequency, and the 13% of the study shows the hearing loss affected at the low frequency audiogram. We believe that it is the conductive hearing loss, as the sound could not travel to the inner ear because of the obstruction of or damage from the outer or middle ear. Okay, and then here we have 7% of the study who do not specify whether the hearing loss affected low frequency or high frequency. Okay, next, we look at the implication and the knowledge gap. So as you can see here, the audiological procedure 27%, only 27% of the studies has conducted air and bone conduction odometry, and the rest of the studies, 73%, only conducted air conduction odometry. So it can be conclude that only 27% of the study capable of distinguishing between conductive and also sensory neural hearing loss. The hearing loss was diagnosed in majority of these selected studies without confirming that it was a sensory neural hearing loss. Therefore, it is very important for all the researchers to critically educate the type of hearing loss so that we can differentiate whether it is conductive hearing loss or sensory neural hearing loss. One way to distinguish conductive or sensory neural hearing loss is by comparing the air conduction and also bone conduction hearing threshold level. Okay, so this is, we come to the conclusion and limitation. The concurrent exposure of solvent and noise might cause synergistic and additive interaction effect. However, actual sensory neural diagnosis could not be confirmed as most of the study do not state any specific bone conduction test in their methodology. Therefore, we highly recommend that more epidemiology studies on hearing effect from solvent exposure use a diverse approach so that the underlying causes could be diagnosed. Okay, so that's all from me, Dr. Dave. Thank you very much.
It was great. Thank you very much. I actually found that quite informative and really quite interesting. Let me switch up my clock. And you're actually within the time frame, which was fabulous. Thank you. Let me ask you, kick off the questions. It strikes me, the obvious thing to me, this is, I wasn't aware of this, so I find it quite revealing. The obvious question for me is, having got all this information that you've done, this research you've done, and recognizing the importance to the public, what is the next step? This is kind of leaping ahead, but for you, what is the next step in your research? Where do you take this in order to make it useful? What's the next piece of research, or how would you see your work moving forward from here?
Okay, thank you, Dr. Dave, for that question. So for the next step of this research, we will focus on the preventive and management intervention for ototoxic chemical. So we will focus how to prevent and how to manage this ototoxic chemical so that all the workers or the employers, especially in Malaysia, aware of these ototoxic hazardous effects.
Right, okay, cool. I'm not going to hug all the questions. Do we have any questions from the floor? Come on, floor, wake up, come on.
Hi, my name is
God bless you.
All right, I don't have questions, but I think this is very interesting to find out that some kind of chemical can make us hear our loss. I mean, hear our hearing ability. This is very interesting.
Yes, yeah, but
I just wonder why you just take like is it 2020 and above articles, right? You mentioned
2000 and above, Dr.
Oh, 2000. Okay, all right, thank you.
All right, thank you, Dr. Mazni.
I might keep going on the same thing. And again, it wasn't quite clear from your paper or the presentation. You've covered it, but it's not clear enough for me, I'm afraid. So let me ask you, it's the cumulative effect between noise and chemical. I mean, I think we all recognize noise can make you deaf. The chemical was the interesting thing. But when you put them together, you touched on can you just explain a bit clearer for me? If I just have the chemicals without the noise, is it 1 + 1 = 2? Or if you add the chemicals and the noise together, you have 3. I mean, do you understand the question?
Yes, Doctor.
Okay, great, thanks.
Okay, so about this interaction effect, actually, Doctor, it is a very quite complex situation, because some studies stated that there is an additive effects only between noise and solvent or toxic chemical. And some of the research claim that there is a synergistic effects, which means that noise could cause hearing loss, and also solvent also could cause hearing loss. But the combination between these two will cause a greater amplitude for the hearing loss of the workers. So
Right, that's 1 plus 1 equals 3, right?
Yes, 1 equal to 3. So some of them stated for the synergistic, like you said, 1 plus 1 equal to 3, like that.
Right. So basically, if, for example, if the noise is, in my mind, I'm thinking to the extension that if you reduce the noise but retain the solvent level, I'm trying to figure out what the result of that would be, but I guess they're two interconnected. I'm not quite sure what my question is there, but it's an interesting relationship. The individual versus the collective effect.
Doctor, actually, for the solvent exposure itself, it will cause hearing loss also. Only for the individual exposure of solvent also will cause hearing loss. That's why what we call as ototoxicant, chemicals that will cause hearing loss for the workers.
Just out of interest, how does that happen? Does it kind of physically erode the eardrum or something? How does it work?
It's because of the inhalation of the chemical, Doctor. Inhalation of the chemicals, it will affect the inner ear of the workers. So that's why later on we would like to suggest that all the workers who are exposed to this ototoxic chemical, they also need to wear hearing protection also to protect their hearing system.
Right. So the solvents are working through the nasal capacity or through the ears or both?
Yeah, it will attack, it will enter through the inhalation.
Right, okay. Interesting. Cool. Any other questions from the floor?
Any other question?
Hi, I know it's Nick here. One last question from me, it may be a question, but is it a study about the concave lens that reflect light? The lens itself.
I'm sorry.
The lens, concave lens, is that one reflect light? How does that concave lens? Because sometimes we have glass, we have lens, because I'm wearing lens. Okay, I know. So I'm just asking, the concave lens, does it reflect the light? Meaning that, is it the way, the change way light refracts to help? Is it more focused image? Have you studied that one? Or you just study
I'm sorry, Miss Nick Mastura. I think this is for, your question is for the previous one.
Yes.
The previous one. Okay, fine. Okay, bye. Okay, thank you, Aina. Thank you, Dr. Dave.
Yeah, mind you, I think if you take the concave lens and stick it in your ears, you might not have hearing loss from the solvents. That's a crazy theory, forget it. Okay, any more questions from the floor? No, okay, listen, thank you so much. That was a really interesting, paper. Thank you so much. And thank you everybody for participation. That was great. Thank you so much.
Okay, Dr. Dave. Thank you, Dr. Dave, for chairing Breakout too. And
yes.
Yeah.